Pete Lucido is the state senator from Michigan's 8th District out in Shelby Township, the Republican. He does not exactly see eye to eye with the governor on all of these executive orders that are put into place. And the governor got deep into the politics last week when Pete Lucido's bill was passed by both the House and the Senate. Okay, it got overwhelming support in both. Went to the governor's desk and she vetoed it. And what would that bill have done? Well, it very simply would have taken better care of our senior residents who pose a greater risk than anyone else in our state for contracting COVID-19 and also from the fatality rate, the mortality rate there. So seniors are disproportionately affected. It's the bottom line. So Senator Lucido had this bill that looked like was on its way to passage that would help seniors, but the governor said no last week. She vetoed it. So let's check in with Senator Peter Lucido of Shelby Township. Good morning, sir.
Good morning.
The big question that she raised, and this kind of stunned me when she was talking about your bill and why she had decided to veto it. She said this legislation fails to explain how such facilities, the nursing home facilities that you'd be setting up or allowing, how they would be staffed or paid for. Let's talk about that for a second, because my first thought was, is she envisioning that you were trying to create a state-run nursing home system?
Maybe. I don't know what's in her mind. She's gotten it wrong, which means she was misled or misguided on how the bill reads. The bill is simple. If Lara and MDHHS certifies that the home in which the individual was living in has separate PPE, separate medical staff, separate, so there cannot be cross-contamination, they sign off on it. They agree to look at it first before letting anybody back in there. Secondly, if a hospital, like we had elective surgeries, they have rehab. Over here, Barbara Rossman runs the Henry Ford Macomb, and she says we could have used our third floor where we do our rehab, put nothing but COVID patients, which we did incidentally, and we isolated them away from all other patients. So if they don't have a hospital, because Ed McBroom up in the Upper Peninsula said, Pete, we may not have a separate facility. What do you recommend? I said, have your hospital designate one floor. Mm-hmm. And at the end of it, I said, Eddie, you don't have anything like we have in Southeast Michigan. Southeast is where all this COVID and all these deaths, including Grand Rapids and Flint, is where all the deaths occurred.
Well, I don't want to get too caught up in numbers, but I want to bring up this number because I think it's very, very important. We have had 6,460 COVID deaths in Michigan. Of those, 31%, 2,001 of them, 31% have occurred in assisted living facilities among senior residents, okay? So senior residents account for only 8% of the cases in Michigan, but they account for over 30% of the deaths.
Without anybody taking any responsibility to change the course and direction as every other state did.
Just amazing.
Why are we different? Why are we different?
And this governor rejects anyone else's input. She just wants to run the state by executive order right now. She's put out more executive orders than the governors of Ohio and Illinois and Indiana and Wisconsin all put together.
We're up over 160, but we've only had 100 days of COVID, a little over 100 days of COVID. She's exceeding 1.4 orders per day.
That's remarkable.
So somebody needs to put the reins on this and says, what have you, I mean, she put together a work group. This is ridiculous.
Mm-hmm. Now,
you separate them. 5 other states, Frank, have taken a different course and direction and path. And Dr. Rebecca Koch testified at both the House and the Senate and indicated she's reviewed all of the data, including the CDC and the World Health Organization policy. And there is no policy that protects these seniors written in those guidelines and in those books, and the governor is wrong. She said it right on the record. This is an independent doctor who's got her own opinion.
Mm-hmm. Remarkable, isn't it? And yet we keep hearing about all this data and science, but we never get it explained. Here, you bring it right up. First time talking about this, Senator. You've got the data, you've got the science, and you got the people behind it. So I appreciate your hard work.
I had expert witnesses to bring to the committee to educate the legislators who have no, superior knowledge or background, to give us some information that may lend itself to helping the people in their districts. And here's the reality. I have a duty to listen to the constituents as an elected officials and do the best job I can. I thought I was doing the best job when I offered alternatives and solutions to the problem that we know has hurt the individuals in the nursing homes.
Well, it's been a partisan issue since day one with this governor and with the attorney general and the like, and so we'll just continue to monitor it and hope that people like you who are interested in the Constitution of our state and our country will continue battling for all the people of our community, including those in nursing homes who have been more heavily affected than any others here in our state in this outbreak of COVID. Senator, thanks. Good luck. I wonder one other thing, though, before you go. We just heard that Senator Tom Barrett, the Republican from Charlotte, is going to be out of action for at least a week after testing positive for COVID-19. How does that affect what you want to try to do with your bill to prohibit COVID-19 patients in nursing homes?
You know, I love Tom Barrett. I'll say it to the entire listening population you have out there, Frank. Tom Barrett is a true inspiration because he's a military man serving for our country right now, even on, in the National Guard. Tom was also on my Judiciary and Safety Committee and sits there. I feel for Tom Barrett and his family. He's going to be out this week. So for us to take a vote up in the Senate to try to override the governor's veto of the bill, Senate Bill 956, to separate those patients, we're going to need a soldier right at the front lines to continue the fight, because I think partisan politics should never take place to protect the most vulnerable population in our state.